There isn't anyone that I know that has lived in Baltimore City more than 2 years that hasn't been impacted by this epidemic.
Well, just as there isn't one factor that drives substance misuse, there isn't just one way to solve this ongoing opioid epidemic. The approach Baltimore City is taking towards ending this crisis. Hi, everyone. I'm Jason Newton. Welcome to 11 TV Hill. Just last week, Mayor Brandon Scott signed an executive order outlining how the city will manage money from opioid settlements. Now, his approach is a partnership between city government and nonprofits. 11 News medical reporter Mindy Becerra explains.
We have literally had a overdose and addiction issue in Baltimore City since my grandparents moved here, right?
Baltimore City Mayor Brandon Scott has big plans for the money the city's receiving from pharmaceutical companies. To date, the city has collected $242 million, and that number could be climbing. Part of that will be used to create an opioid advisory board. The city has already received dozens of applications, and Mayor Scott says they'll keep taking them through the end of the month.
Our applicants include 16 residents who identify as being a member of Baltimore harm-based reduction organizations, 4 practice licensed addiction medicine specialists working in Baltimore City, 2 practice licensed social workers in Baltimore City, 8 public health practitioners or public health experts from universities in Baltimore, 11 peer recovery specialists working in Baltimore City, and 29 Baltimore City residents with lived or living experience.
A position on the board also comes with $15,000 in compensation. Some of the money will also go to various nonprofits and programs doing grassroots efforts to address drug misuse. So far, $42 million is being spent on that.
They can't just spend it on whatever they want to. They have to go, the Mayor's Office of Recovery Programs will be overseeing that to make sure that it's being spent on the things that it should be spent on, to make sure it's being used wisely.
The organizations reach various communities with a diverse range of programs.
There isn't anyone that I know that has lived in Baltimore City more than 2 years that hasn't been impacted by this epidemic, right? I think you heard from the council president last week about his brother, who just happened to be my neighbor. That's how small Baltimore is.
Mayor Scott also gave credit to one of his predecessors, former Mayor Kurt Schmoke, for the work he did to fight addiction in the city as far back as the 90s.
He was ridiculed and he was cast aside, and it essentially was political suicide for him to do that. And I think now, in this moment, and say, how different would not just Baltimore, would the United States be if we listened to folks like Mayor Kurt Schmoke when they did that needle program and things that were innovative back then? How different would we be?
As we move forward, Mayor Scott says we need a culture shift to make meaningful change.
Not just here in Baltimore, but as a country, we have to move away from this mindset that some people still have, that people who struggle with addiction are less than, that they're inherently criminal, and we have to treat this health disease in a health-informed way and truly try to cure it.
And joining us this morning, 2 organizations receiving funding from the opioid settlement. We have Daniel Stoltzfus, he's from Helping Up Mission. Also, Dr. Stan Andrees from Prison Cells to PhDs. Thanks for coming by, both of you.
It's a pleasure.
There were some definite head nod moments throughout that whole speech from the mayor. And one that stands out is that everyone is affected. No doubt. This touches everybody, opioid addiction. Tell me what for you, the moment in there as you heard him talking about that. Either one of you.
Well, I've told people since we have really focused on these statistics in the last couple of years, these aren't just statistics for us at Helping Up Mission. They're people whose names, like Angie and Quinn and David, people that we know and we've served who have been affected by this, those overdose deaths. So it's very personal for us, and it does cut across every demographic, every neighborhood in our city. Sure. Every socioeconomic situation.
Sure, Dr. Stan, you touch a lot of lives throughout your program, and I'm guessing some of them, like this wasn't an intended result for them, but opioids found them, and this is the position they find themselves in.
Yeah, so, from Prison Cells to PhD, we help currently and formerly incarcerated men and women pursue higher education and meaningful employment. And the intersection of opioid use and, the path to incarceration is intertwined with each other. About 75% of the people that we work with have some type of substance use issue, and most of those are dealing with opioid use, particularly here in Baltimore City. So, I mean, we see it at the family level, at the, you know, what it does to their children, what it does to the community. So, you know, we're really trying to find pathways to help the individual put their lives back together, and, you know, that invariably includes helping them with this particular challenge that they're facing. So.
About the same for you as well. Homelessness and addiction seem to go hand in hand in some cases, and you're helping to hopefully change some of these lives. Tell me what the shell of the person looks like when they first enter with you guys.
Right, it really comes across all kinds of situations. Some that are formerly incarcerated that are coming to us, some that are coming off the street, some who are coming from very affluent backgrounds or, you know, situations, all different kinds of needs. Tremendous talent that's been sort of sidetracked by addiction and homelessness and despair. And so we try to meet them where they're at. We offer a long-term residential recovery program, and the average client that we're serving is 15 to 20 years in active addiction, and we just believe that a longer-term 12-step spiritually oriented program is a resource that we can offer, and we want to provide that hope. We like to describe what we do at Helping Up Mission as a community of hope.
Yeah.
And really inviting people into that community so there can be life transformation. It takes a lot of clinical supports. We have partnership with Johns Hopkins and GBMC Health Partners that provide those supports. It takes a lot of peers, people with lived experience. 70% of our staff are graduates of our program.
Oh, wow.
And so they can really help people say, hey, I've been there.
Yeah.
Here's what helped me in my recovery. Now let me help you get to that next step.
Sure.
And so that's the power of that community.
And since you bring this up, and Dr. Stan, you take it wherever you want. I read your bio, and part of walking the walk is living the life yourself.
Yeah.
I mean, you weren't always Dr. Stan.
Yeah, I was gonna say, you know, our clients look like me.
Yeah.
They have experiences like me. So myself, I am a formerly incarcerated person with 3 felony convictions, was sentenced to 10 years in prison as a prior and persistent career criminal. I actually had a prosecutor pushing for 20 years to life in prison because she felt that I had no hope for changing the decisions that I had been making up until that time in my early 20s. Fast forward some time, I did my time. I'm now Dr. Stan Andrees, endocrine scientist and assistant professor at Howard University College of Medicine, a place that I like to call the Mecca. I was brought here to Baltimore about 10 years ago. I was at Johns Hopkins for about 5 years before moving to Howard. So you know, it is that lived experience that brings me to this place. So growing up in Ferguson, Missouri, I got involved in making poor decisions at a very young age, started selling drugs before I was even a teenager, arrested for the first time at 15, moved into the juvenile system and continued making poor decisions till I was sitting in my early 20s looking at 20 years to life, and essentially got hit with the 3 strikes law of Missouri. So, you know, the people that, you know, we work with look like myself and look like the experiences that I faced. You know, Ferguson is, you know, growing up in St. Louis and the Ferguson area is very similar to Baltimore and the challenges that it faces. So, you know, when we see individuals, just like was just mentioned, about 85% of our staff are formerly incarcerated people, and most of them are former participants, and we call our participants scholars because we try to move away from using terms like felon, convict, prisoner, ex-con. So we call them scholars, and about 85% are past, you know, of our staff are past participants.